Institute here in Melbourne, Florida, on the Space Coast, and it is June 7th, 2022. Thank you. We're going to be performing a cervical, that's the neck, Deuk laser disc repair to repair 2 herniated discs endoscopically. What's unique about this surgery is many things. Number one, it's minimally invasive through a 4mm skin incision. Number two, we don't put any metal or plastic in the neck. No biologics at all right now. And number three, it's done endoscopically through a small little tube. And we use a laser to remove the herniation and debride the annular tear. The annular debridement really takes away the neck pain, and removing the herniation gets rid of the arm symptoms. So we're just going to get started. This is the left side of her neck. Her worst symptoms are on the right arm. We always go the opposite of the worst symptoms. Shot. All right, so 2, 3, 4, 5, 6, 7. We're down at C7. That's a little lower than I want to be, so I'm going to go a little higher. And her neck is perfect. She has a nice thin neck. Shot. All right, so 2, 3, 4, 5, 6. We're at C6. So we can start maybe a little bit higher right around there. Shot. That's still a little lower than I want to be. She has an amazing neck. Honestly, wish all of them were this way, but that would be too much to ask for. Shot. All right, so this is how I start, and now that I'm in the middle of the 2 discs with this location, I'm just going to slide. Shot. Slide everything north. Shot. And there we go. Give me an AP. Now I want to check my AP quick. There's a quick AP because I want to make sure I'm in the middle. That's too far to my side, so I'm going to go a little bit further towards the middle. Shot. Perfect. Lateral. So you always want to navigate using what's called AP and lateral fluoroscopy. AP is front back, lateral is side. Shot. 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 I'm moving my fingers, but not my needle. Shot. That should be good. Give me an AP. Quick AP. That's good. Yeah, I like that. Back to a lateral. It's a good entry point. We're on the anterior longitudinal ligament, the ALL. And shot. We're entering the disc at C5-C6 right now. Shot. Shot. And again. All right, so we're right about the middle of the disc. 2, 3, 4, 5, 6. I've got 5, 6. What do you have?
I've got 5, 6.
The way we know what disc we're at is we count the bones. And at the top you can see a tall bone, that's number C2. Yep, perfect, Jordan. And then 3, 4, 5, 6. So we're going to be performing the Deuk laser disc repair at C5-C6 and C6-C7, the disc below this one. So at this point, I want to get an AP and verify that we're in the middle of the disc, which we should be. Now this is the first time you're probably seeing this surgery if you've never watched a Deuk laser disc repair. But this endoscopic cervical spine surgery was taught to me by Korean surgeons at the Wardydal Hospital about 17 years ago, this part of the surgery, accessing the disc, and by Dr. Stefan Hellinger, and he's in Germany. He's a pioneer in endoscopic surgery as well. Now, lumbar surgery, I learned as well from the South Koreans, but also from Hellinger and also from Dr. Anthony Young. Yeah, oh, we're not going to see it, right? We're saving the dye. No problem. So we're not going to see the discogram dye. There's actually a shortage of dye, unfortunately, in the United States. And to save dye for procedures that it's absolutely necessary, we're not using that dye. It's called Omnipaque. My personal feeling is that shortages are artificially created by the pharmaceutical companies to raise prices. A box of dye right now is about 5 times the price of what it normally is. Same thing's happening with lidocaine. There's absolutely no reason there should be a shortage of these drugs and supplies. And shame on the FDA for not allowing us to go outside of the United States to purchase, because they're all manufactured outside the United States anyway. It's a very corrupt system centered around the FDA. The FDA says in the United States we can only use American, basically companies that are contracted with the FDA in a way, like certified by the FDA. And we're only allowed to buy these drugs in the United States, but they're all manufactured outside the United States, in India, China, not really in the United States. And so we can't go to India and China and directly buy the drugs from India and China at much lower prices. But the companies that sell them to us can buy them from India and China at much lower prices and then jack our prices up. And that's what happens. And these pharmaceutical companies in the United States are basically in cahoots with the FDA to basically overprice all of our medications. If you go to India, you might buy a bottle of lidocaine for 25 cents, but here in the United States, you're going to pay 10 times that amount, even though it's the same, and it's manufactured in India by the same company that they use in India. So our supply costs are massive in the United States because of corruption at the highest level of the government. But you know what? That's pretty standard, unfortunately. There's nothing I can do about it. Not at this point, but make people aware. Shot. All right, at this point we are at the front of the C5-6 disc, and we've got our dilator tip right on the anterior longitudinal ligament, AP. And I verified at C5-6 at least 10 times because I want to make sure we're doing the right level. 2, 3, 4, 5, 6. And everyone agrees? Shot, perfect. Yeah. So you can see the tip of the dilator is just a little bit to the patient's left of the midline, and that's fine. You want to be about a centimeter from the midline, either way. A centimeter is a centimeter, for those of you who think my accent's funny. Now I'm going to advance the tip of the dilator through the ALL, anterior longitudinal ligament, under fluoroscopic guidance. Shot. I'm inside the disc now, inside the anterior annulus. Shot. And at this point, I'm going to remove my guide wire and use a mallet to gently advance the dilator to the back of the disc on the patient's right side. Now the herniation this patient has is really on the center and the right, but we need to get the center and the right, as well as we're going to check the left side to make sure there's nothing on the left side as well. Is she fully relaxed?
Double check it. She was.
Can you give me a little inline traction?
Yes, she was. Okay.
A little inline traction, just, yep, with slight extension, perfect. Shot? Yep, that's nice. Shot? Very good. All right, so the dilator is perfect. We're literally sitting inside the annular tear where the herniation originates from, in the back of the disc. And Jordan, will you show the audience where the herniation is, since we don't have the benefit of our IV contrast dye? Yeah, the herniation is going to be bulging out even further. Yep, there you go. And that area back there is called the spinal canal. That's where the spinal cord lives and the nerves live. So herniations in the back of the disc compress or irritate the spinal cord and spinal nerves, causing neck pain, headaches, arm pain, weakness, numbness, and tingling in the arm, which this patient has symptoms in her right arm. Huh? And she has also neck pain. The neck pain itself comes from the annular tear. Let's go ahead and run the video, Henry, on what causes neck pain when you have a herniated or bulging disc or degenerated disc. Might surprise you. It's due to inflammation. Doctors. All right, little inline.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. The video you just watched explains why people get pain in their neck or lower back, for that matter, from a herniated disc. It's actually the tear in the annulus that gets inflamed, and you get an ingrowth of nerve fibers that are pain fibers, and all that inflammation going on in there caused by the nucleus pulposus irritates those pain fibers. Now, do you see this here?
Yep.
I'm just going to orient you here. The patient's face is here. They're looking up at you when they're covered. There's a tube in the mouth, and they're under general endotracheal anesthesia, so they're completely asleep. And we're doing the entire surgery through, let me show you this. It's literally almost like a little coffee straw made out of metal, but of course it's not a coffee straw. It's a surgical instrument. It's called a tubular retractor, used in endoscopic surgery, and it creates what's called a portal, a way for us to get down to the herniation. The only damage we're doing to this patient's neck is the cut right here, 4 millimeter cut. No metal, no plastic, no fusion, no artificial disc. This surgery results better than artificial disc, better than fusion. There's no adjacent segment disease either. So this patient didn't want a fusion, they didn't want metal, they didn't want an artificial disc, so they chose the Deuk laser disc repair. It's the newest, most advanced surgery for cervical disc herniations. Now, here's the endoscopic rig. We have a camera, an endoscope, light source, irrigation, laser fiber. We're going to get started. I'm going to turn the irrigation on, and we're going to go down the rabbit hole. All right, first thing, can you see the endoscopic view? It's a little bit blurry. I'm going to try to sharpen the image. That's perfect.
There you go.
Yeah.
Much better.
Thanks. So how many of these endoscopic surgeries have we done at Deuk Spine Institute? We've done 1,500. And the success rate of eliminating pain in the neck and the arm is 98% on average. 98%. There is no fusion surgery or artificial disc surgery that gives you that percentage.
Are you good? Are you ready?
When I go in like this, that means you turn that laser on, okay? Don't make me stop and have to tell you. All right, there's the herniation right there. You can see it's stained blue because we used a blue dye. There's two types of dye we use. One is so we could see the center of the disc and the tear and the herniation on the x-ray view, but we didn't use that dye today because there's a national shortage of it, and we just don't have enough of it. We can't get it. So that's fine. The dye we are using is called indigo carmine, and it's a dye that stains degenerated nucleus pulposus. Degenerated nucleus pulposus. That was taught to me by Dr. Anthony Young. Dr. Young trained under Dr. Parvis Camden. Dr. Parvis Camden was the first surgeon in the world to develop the transforaminal endoscopic technique for the lumbar spine. And taught Dr. Young, who then popularized the technique in the United States and has been done over 10,000 surgeries compared to my 1,500. So he's just, look at that. That is the posterior longitudinal ligament and the dura right there. So you can see the herniation went right through. We're going to be cleaning out the herniation right here. Now, the patient asked me about bone spurs. There are some bone spurs, and the laser can remove them. There's one. I just took it away right there. Okay? And we're going to do a little more in a minute. But right now, I'm going to continue to remove the herniation first because it's pretty big. Look at all this. This is all herniation right here. We're going to get rid of all of that. Now, this Deuk laser disc repair surgery you're watching uses a combination of laser to basically free up the herniations because they get scarred down to the annulus. There's a piece right there, and we call that a reverse herniation. Okay, it comes out of the epidural space or the foramen where it was compressing the spinal cord or nerve root. There's another herniation right there. See how we can take these herniations out without opening up the patient's neck and doing open surgery? This is endoscopic surgery. There's still an incision made, but it's 4 millimeters. No other surgeon can do this unless they use an endoscope. It's impossible. You can use a microscope, but a microscope is not as good as an endoscope. And it will not allow you to do this surgery. You still have to open the patient up with a microscope. We have a microscope here. We have actually the best microscope in the world for surgery of the spine. It's a Zeiss. And it's top of the line, but we don't use it because we don't do fusion so much anymore. We're doing endoscopic. All right, could not get it. So back in with the laser. By the way, this is her right side of her C5-6 disc where those big herniations are. I'm just going to have to break them up into smaller pieces. It's a common technique used in neurosurgery where we take a big mass and we break it up into smaller pieces. We call it a debulking. And by breaking it up into smaller pieces, it's easier to remove those pieces, safer for the patient, so you don't have to make as big of an incision. But it's called debulking. And we're just going to debulk this thing until there's none of it left, because it's too big to take out otherwise. So we use a laser just to break it up. Any questions from the audience at this point?
Yes, we have one from Rick from Facebook,
Hi, Rick, on Facebook.
and he asked, hi, this is Ricardo. We
A
had
little bit louder, I just can't really hear you.
Of course, no problem. Hi, this is Rick. We had a consultation not too long ago. You said my problem might be facet joint pain. Can you fix this problem too? We never had time to discuss that. Thank you.
Too low volume and too fast.
Okay.
I missed that whole question, I'm sorry.
I apologize.
Yeah, remember.
Yeah. He said, hi, this is Ricardo. We had a consultation not too long ago. You
Yes.
said my problem might be facet joint pain. Can you fix this problem too? We didn't have time to discuss that. Thank you.
Hi, yeah, so of course I won't discuss any of your details here publicly, but we can definitely fix facet joint pain as well. This surgery you're watching fixes disc problems, herniated disc, bulging disc, degenerated disc, and the pain caused from them, and symptoms in the arm from the nerve root being irritated or compressed by the herniation. However, we can also fix facets. We have several facet joint options. One of those treatments, and by the way, treatment of the facet joints to eliminate facet pain is not commonly found in the United States. It's done typically by either a spine surgeon or interventional pain management doctor. And most of them don't do cervical facets, they do lumbar. They don't do cervical, they don't do thoracic, because they don't know how to do those. At Deuk Spine Institute, we do cervical, thoracic, and lumbar. And we do the typical treatment, which is called a radiofrequency ablation, or RFA. But we also do a new type of rhizotomy done with plasma. And it's much more powerful and in my opinion, far more effective than the rhizotomies done with radiofrequency ablation. So we have radiofrequency ablation rhizotomies and we have plasma rhizotomies. We also have what's called an endoscopic laser rhizotomy. It's another type of rhizotomy. So we do all types of facet joint treatments, very effective. We start with the radiofrequency ablation because if that works, it's less energy delivered and less postoperative pain and discomfort. There's a herniation right there. And if it works but it doesn't last, I'm going to try to grab that one out with a grabber. If the RFA works but doesn't last, then we can do a plasma rhizotomy, which is only found at Deuk Spine Institute, just like the Deuk laser disc repair. I don't know if I got it. Did I?
Yeah, a little. Yes.
A little bit?
Yeah.
All right. So, yes, my advice is come to Deuk Spine so we can get you taken care of. I don't remember your specific recommendations, but I shouldn't discuss them anyway publicly. So, hopefully that answers your question. This is all herniation at C5-C6 right here. And you can see we're now at past the middle, so it's on both sides. It's on both sides. It's not just on the right, it's on the left as well. These are pretty big pieces, so I'm trying to break them up, and the little pieces will float out. The big pieces don't really float out. You have to go in with a grabber and grab them out. And that's what I'm doing. Let's go ahead and show the audience how the Deuk laser disc repair works to treat herniated disc in the cervical spine.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Giant herniation coming out of the right foramen at C5-C6 right there. All right, huge. Literally just migrated out of the foramen right there. It's too big. I'm going to try to grab it. See if I can grab it. That's a huge fragment of herniation. And again, it really highlights, sorry, that's the left foramen, I believe. This surgery highlights the fact that, couldn't get it. I'm going to have to keep working on it. That herniated discs are not one herniation. They're really episodic, and because they're episodic, it means they happen in many episodes. And what you get is a bunch of herniations. See, I'm cutting a piece off to get it to float out, and I'm just going to have to break it up into little pieces. It's a little more work, but it's fine. At some point, it will be small enough that I can get it all out. Right now, I'm just going to have to float them out one at a time. But the important thing to remember is that when people get have a herniated disc on their MRI, it's usually like 5 or 10 or 20 pieces of herniation. It's not one. Now sometimes we do get one big one, you know, we show those. Like this is a pretty good sized one right here. I've been trying to get it out, but maybe I can get that piece out. But usually in the lumbar we can get a big piece out when it's there. Oh, I feel something. There it is. All right, let's take a look at this. Get the light on. Can you see this?
Yeah.
Good picture?
Yep.
Yeah. So that's a pretty good size herniation for the cervical spine. Remember, the discs in the neck are much smaller than the discs in the lower back. The discs get bigger as you go down the spine. So cervical discs are tiny compared to lumbar discs. And the herniations, of course, are also smaller. And because you're so close to the spinal cord, you don't need a big herniation to cause symptoms. You know, the nerves and spinal cord are right behind the disc. So smaller herniations, they don't have to travel as far, but they're quite painful and cause symptoms very easily. All right, so there's a herniation right there. It just came out of the crack down there. That crack is the epidural space and the foramen. Just trying to get it to move itself up and out. How's my pressure? Good? No. Bag pressure, sorry. The pressure of the irrigation. Yeah, sorry. Should have been. Yeah. I'm not having any issues. I'm getting good flotation, so as Pennywise says, they all float down here. They all float. You know? Who's seen the new movie, The Northman or Norseman? Anybody?
Saw it last week.
Good movie, huh?
Fantastic.
Yeah. And everybody knows the lead actor is the Pennywise actor. The guy who played Pennywise in It, the most recent movie It.
That's incorrect. That's his brother.
No, it's him.
Mm-mm.
I think it's him.
The Northman lead actor is Alexander Skarsgård. Pennywise is Bill Skarsgård.
Oh, really?
Yep.
I thought it was the same guy.
No.
All right, my apologies. Well, I guess they're brothers, yeah. Thank you for clarifying that.
No problem.
Who saw
Top
Top Gun?
Gun? Yeah, a lot of people saw Top Gun. Yeah, I saw Top Gun too. Great movie. Apparently I heard the family of the guy who wrote the book Top Gun, they're suing the Top Gun movie now because they didn't get permission, copyright permission to do the movie from the family.
So did they get permission on the first movie?
Yeah, they got it on the first movie, but not this most recent one. Anyway, everything's going well. For this patient so far, we're at C5-C6, and I'm going from side to side. I don't see any more herniations, just some basically the posterior longitudinal ligament behind the vertebral body, but no more herniation. So I'm going to keep looking for another minute. I think there's going to be some out here in the lateral area, but it looks like we've gotten about 80-90% of it. So for those of you wondering, do you ever get 100% of a herniation? The answer is no. I've never gotten 100%. Nobody's ever gotten 100%. Endoscopically, you can get the most herniation, but nobody else really does endoscopic except me in the United States, cervical and thoracic, and it's impossible to get 100% of any herniation no matter what technique you use, but the endoscopic is the best technique, and you can get the most herniation with the endoscopic technique. So all the other open techniques you don't get as much. The reason is you can't see as well. The endoscopic lets you see everything, you know? Oh, Yeah, there's definitely more here. There we go. That's a big piece. Let's see if I can grab that out. Yep, take your time, switch it. I'm starting to feel a little wetness on my foot. I'm wondering what's going on over here. There's a piece. All right, let's bring the scope back. Are we back online with the irrigation? How are we doing on irrigation? Good. Any more questions from our audience?
This next one isn't a question, but they are seeking for help or advice.
Again, you're not audible to us.
Sorry.
You're talking too fast and too low. Why don't you bring the mic a little bit closer to your mouth?
Yep.
So naturally we can hear you the first time.
Okay. How's this?
One more. What again?
Testing, 1, 2, 3. How's that sound?
It's still a little low.
Hold on. All right. I'm turning it up. Should be
Sorry?
good. Should be good now.
Yeah, it's better, but I think there's some static.
There is. Okay.
Grabber.
Does this sound better?
A little more volume.
Yep.
That's better.
Okay.
I'm not
And how about now?
Just try talking. Let's see.
Okay. So this next one comes from...
Yeah, that's better.
Yep. Okay. This one comes from Miguel on Facebook.
Hello, Miguel.
And they said, "Hello, doctor. I have a right paracentral T8-T9 thoracic disc herniation, and I have been enduring pain since September. I can't breathe well, and it hurts a lot."
Yes, I understand. We can fix it easily here at Deuk Spine. Yeah, we can do a thoracic disc herniation surgery. As a matter of fact, why don't you post the link, Henry, to
Yep.
thoracic Deuk on YouTube, the thoracic Deuk laser disc repair playlist, so he can see.
Copy.
But I don't know what your question is, but yes, we can fix that thoracic disc herniation with this endoscopic technique. You guys doing all right over there? Come on. What's going on? Is there a problem? Okay. All right. What was the question from Miguel?
It wasn't really a question. He was just
Oh.
seeking advice or help on that.
Give me the grabber. Yes, Miguel, we can fix your thoracic disc herniation with the same endoscopic technique. It takes 30 minutes, and it's outpatient. You don't have to go to the hospital, and you don't have to have a fusion or any kind of crazy surgery. It takes literally just 30 minutes, and then the total surgery time is an hour, and it's outpatient. I knew I didn't get it. It's just won't fit. So I'm going to have to cut it down. Yeah, please watch the surgeries on our YouTube channel. I've done now, let me try that, 16 patients with thoracic disc herniations. And I presented my studies, my work in Los Angeles in February of this year at a meeting that I was invited to speak at as a to talk about the Deuk laser disc repair for thoracic herniations. Huh? Oh, we're doing one on Thursday. Thank you, Luis. Luis mentioned that we're doing a thoracic laser surgery Thursday. So if you want to come back and watch Thursday, you can watch one of those surgeries. All right, we're just about done here. Let me flip it one more time and make sure we don't have any more herniation out laterally. Just a little bit, maybe underneath there. I want to make sure we get that as well. All right, why don't you show the audience the difference between this surgery, oh, there's another piece that came out. I'm glad we stuck around and checked. Another herniated fragment. And that's what a typical fragment looks like. When you get a re-injury to your neck and it starts to hurt again after you do something, it's because another little piece went out. I cannot get any more. Maybe over here. What's happening with the OR temperature? Because it's kind of warm. Really? That's pretty cool, right?
We can go
I know.
60 if you want.
Oh, is there something?
Huh? 67, well, we need that. We need to.
What? Wait, who's controlling the temp?
No, it's just probably because too much body's here. And, yeah. We put a 62 this morning. No, it's already 62. Tell.
So you're as cold as it can be?
Yeah, tell Shed to put a 60.
Yeah. That's a problem. Let's get that dealt with right away with Chet.
Can you,
Yeah, you may be right, but the humidity is high because the air is not being conditioned. Do you understand? So by lowering the temperature, it's going to condition more air. The only way you can get the humidity out is by processing the air through the condensers. And that's what takes. This thing. Give me a grabber.
Yes, sir.
All right. This should be it for. There we go.
Doctor, you mentioned something about the email.
I'm sorry? Oh, the email.
Yeah,
Yeah. Your email at the bottom has like all these pictures, like Surgery Center Vieira and Millennium Medical.
so I need to talk to Shed.
I would just get rid of those
Okay.
because they don't even come out properly.
I see. Well, I need Shed.
And you have like 20 of them down there. Yeah. And it's really hard to find the file attachment that you sent because all 20 of them are quite literally clogging up the bottom.
Oh, I'm sorry.
No, it's all right. I'm just making you aware of the issue. Because you sent me some attachments and
Yes, yeah.
I was trying to find the attachment and all that clutter down there.
Doctor, do you still want me to play the cervical comparison video?
Yeah, you're supposed to have played that.
You paused mid-sentence. I didn't know if it was still going. Okay.
Done.
Lights on, please. Thank you.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
All right, welcome back. We're advancing the tubular retractor down the dilator in C6-7. You can count from C2 down. And we were just talking about how the discograms today, we're not using the IV contrast dye because we don't have any available because there's a national back order. And I was talking about, it reminds me of the old Enron days. For those of you who know Enron, if you're old enough or read about it, Enron was a very corrupt company, and they would basically shut down nuclear power plants that supply energy to California, and they would say the power plant had problems, that they had a malfunction or something broken, and because they shut a power plant down, the other power plants could charge more money, and they would raise the cost of electricity in California up 10 times, literally tenfold, 1,000%. And they were able to do that. The regulators allowed them to do that only if they had a broken power plant. And so they would fake the power plant to be broken in order to shut it down and raise the cost of electricity tenfold. They made huge profits to the tune of billions of dollars doing that. It's very corrupt. They got caught, and now they're out of business. But the point is that that kind of stuff happens all the time in the United States of Great America, and we allow it to happen. And right now it's happening in the pharmaceutical industry, and they've been doing it for years, where they have these artificial shortages of drugs and supplies so they can turn around and charge hospitals and surgery centers 10 times the price. And it's disgusting, and people should be aware of it, and so we're making you all aware of it. It's really upsetting because it really affects patient care. This patient's going to do fine. We're going to do fine without it, but it's one more piece of information we're left without. Scope on, please. Is it on? Is that the light right there? Seems a little low.
Thank you.
Maybe it's, yeah. All right, that's fine. Let's just see what we got. All right, we're going in now to C6-7, the bottom disc that we're fixing. This is the worst of the two. The last one was far worse than I expected based on the MRI. The MRI didn't look too bad, but it definitely was degenerated and herniated, and we found that. So this one has a larger herniation right in the middle, and we're going to go get that herniation out. So feel free to ask questions. You just watched our video on comparing a traditional surgery for herniated disc. There's a piece of herniation right there. Let's see if we can get it to float out. We'll grab it. And the traditional surgery that I was taught back in my residency, which I went to the University of Florida in Gainesville from 1997 to 2004, we were taught how to do fusions, ACDF, and artificial disc surgery, because the artificial disc came out in 2002, and we were one of the pilot universities with our faculty putting artificial discs in for companies like Deuk, Synthes, Medtronic. Long story short, once I got into practice, I learned about endoscopic surgery and went and watched some of them done and was so impressed. I wanted to learn how to do it myself because I could see it being the future of spine surgery. And the results that we got were just incredible. They were far better than fusions and artificial discs. People who were in pain for 10, 15, 20 years, the pain was 100% gone with the Deuk laser disc repair surgery. And I had better results with the laser surgery than even ACDF, and my ACDF results were phenomenal to begin with, some of the best in the country, with complete relief of pain. It's just sticking. Anyway, I saw that with the laser surgery, the endoscopic surgery, that people's neck pain would go away completely, that they had for 10, 15, 20 years. We even had people in automobile accidents. They were coming. They would have neck pain since their auto accident, whether it's 6 months or a year, and that pain would go away. Then we had workman's comp patients. Their pain, there's a big herniation. Their pain would go away. So it didn't matter if they were work comp or auto accident or just regular insurance people, their pain went away with the surgery. And so these are populations of patients that typically, as doctors, we talk about not being able to get better with surgery, but they were getting better and they were going back to work. So workman's comp started covering our surgery years ago, and they don't all cover it, but some do, most do. Those that don't are just ignorant about it, and we do our best to educate them. But some of these companies just want old-fashioned fusions done. Fusions are going to go away, folks. If you're considering having an anterior cervical discectomy and fusion or an artificial disc, they're all going to go away eventually and be replaced by this surgery, the Deuk laser disc repair. The only thing keeping that from happening today is greed and ignorance, lack of training by surgeons, greed by surgeons and training facilities and implant companies that just want to sell implants, metal implants, artificial discs, metal plates, cages. They don't really care about the patient. They just want those implants going in so they can make their billions of dollars a year in profits. But from a patient standpoint, the best treatment for the patient is going to be endoscopic spine surgery. Specifically what we're doing today, the Deuk laser disc repair. Now in the future, other people may not call it the Deuk laser disc repair, but that's what it is. We were the first to publish this technique. And if you go back to 2012, like 10 years ago, you'll see our first publication on this surgery about its being a safe procedure. And then another publication how it was safe and effective at treating herniated discs, bulging discs, degenerated discs, ruptured discs. Oh, there we go. That's a nice herniation that came out. Still warm in here. What's Chet doing? Yeah, you need to follow up with him until you get resolution of the problem. I'd like to know what the plan is. Can you have Chet come in the OR? I'm sorry? Thanks. Now we're going to be done in about 15 minutes, Doctor.
Thank you.
You are welcome.
She's doing great, vital signs are perfect.
Good. So our anesthesiologist, Dr. Verndes, says the patient is doing really well. She's stable. Her vital signs are stable. There's a big tear here. I don't know if you guys are seeing that. I'm not really talking about it, but huge tear. This is the right side. Big herniation. More pieces of herniation just floating out. You know that's a herniation because it's a fragment of nucleus pulposus. And the nucleus pulposus shouldn't be fragmented. It's supposed to be one big giant blob. And basically, that's not the case right there. All right. It's fragmented. Pieces have broken off. That's the herniation process. Huh. This is the right C6-7. A lot of herniation still right here. I'm going to flip around. I'm sorry? What'd you say, Jordan? Look at that. Oh my gosh. This is a monster. There is some calcification, but this is mostly scarred up right here. There is a little bit of calcium in there. You can see the golden. Huh?
You said it first initiated in a car accident
1999 car accident. Doesn't surprise me. Yeah, so this patient's neck injury, disc injury happened in 1999 in a car accident. Um, Any questions from our audience? All herniation here.
No current questions.
Stained blue. All right. Great. More herniations. Let me grab that. What'd you say? Will you call Foley at 1288? Henry,
Foley 1288.
just dial 1288.
Oh.
Why is it so warm in here?
I don't know that. I'm pouring down to 60.
Well, please go figure it out.
Hey, Chad. Yeah, it's probably not gonna lower than 60, but we can put 48. 48. Okay. Yeah, I know.
Yeah, so just so you all know, I've been working here 10 years. It gets colder than this. So there's something wrong. You need to find out what it is.
Okay. So I know one of the waters was down. That's what he told me last week. That's why I put it
And it's time to find out what's going on. That's why you're here. It's not to tell me you don't know what's wrong. Well, there's definitely a worsening here. There's some evidence of old injury, but there's also fresh injury. You can see fresh fragments of herniation, probably responsible for her deterioration more recently in her symptoms of worsening symptoms that she's been getting. Look at all these pieces of herniation. That right there is a more recent fragment. That's what a more recent fragment looks like. It looks furry. The furry parts are not scarred, so they're more recent. These are all fragments. We've seen probably at least 20 by now from this disc. And here's just more. So, you know, this is not possible to see unless you do endoscopic spine surgery. And I'm the only one in the United States doing cervical endoscopic spine surgery. So I'm literally the only person in the United States of America that can see all these pieces of herniation. And other doctors don't even realize that herniations are multiple fragments. Multiple fragments means many pieces because they don't do endoscopic surgery. They never have. So you can't possibly know something if you've never looked and seen it. Oh, that's quite a herniation there. It doesn't want to come out. I'm going to have to release it. So the problem with that is that there's this facts that are existing out there about our world that people don't know because they've never seen them, you know? Like right now we're discovering new things in space that we had no idea existed because we weren't able to see them before. Now we're seeing things. Oh, that's a big one. Oh, I think it broke halfway up the pipe. So when you develop new tools and you're able to see in places you never saw before, then you start to see things nobody's ever seen before. And that's what these herniation fragments are. They're things that nobody's ever seen before. Because we never had this good of a view of the back of a disc where the herniation is. A microscope doesn't give you this view. Only an endoscope does. What the fuck? How's that pipe? How's the flow of water coming out the back?
Oh,
This.
it's better? Okay, it's good.
You can shut it down by doing that, all right? So when you see it, do that.
Okay. I don't want to press
No, it's all right. No, when you see it, do that. That's not going to press the fiber. That's a little bit of a bone spur there. Little bone spur right there. We just blast it off and go back and oh yeah, there she is.
You have about 10 minutes?
Probably about 10 minutes. It's hard to say. We just keep getting more and more of this herniation coming out. It's like the never-ending herniation. We've seen these before.
Crystal, can I get an IV bag? IV bag, I'll leave it.
This little guy right here reminds me, if you've ever gone snorkeling on a reef and seen a flounder. Have you ever seen a flounder fish?
Oh, yeah.
They're flat and they scoot along the bottom and they're hard to get to. Look at that guy, just disappearing.
I was lucky to grow up on one of the nicest reefs in Florida.
Yeah, you did.
Red Reef.
Red Reef?
Red Reef, yep. Boca Raton, Florida. They
Nice.
built an entire park around it.
That's awesome.
Yeah. Beautiful park.
All right.
Walked over there with my fins and everything.
Go scuba diving,
No, just like
snorkeling. Oh, that's awesome. How old were you when you were snorkeling?
probably
10?
10. I started at about.
Have you ever gone back and seen if the reef is still there?
It's still there. I just
Really?
haven't gone in.
Any good?
It's still, they keep working on it, preserving it. So, we do a lot of work maintenance to it, I guess.
Really? Never thought of Florida's reefs as being that nice, but I never really had a chance to kind of see some of these reefs.
The one in the Keys is really nice, John Pennycamp.
Yeah, I've been John Pennicamp. I dove that. I dove the wrecks.
I took my kids there. That was fun.
But I also know the reefs have been dying, so I don't know the current state. I haven't been down there in a long time. Been too busy with work, racing. Luis,
Yes, sir.
try to help Chet. This air conditioning issue has to be fixed.
Yes, sir.
By the way, that's a bone spur I'm just drilling down. For those of you who wonder, can the laser remove bone spurs? We have this laser at 20% of its power right now. And you saw how easy it removes bone spurs right there. I could take the bone spur out faster, but I'm not going to. I want to take it out safely. So I'm going to go slow, peel it away. There's another piece of herniation right there. Just so much herniation back here. I'm thinking, yeah, under 10 minutes, doctor. Unless I find a surprise somewhere. But things are coming along nicely right now.
We got a pressure good.
Yeah, no. We're just about done. I'm looking here and I see the PLL. Not right here, but in the middle area. It's all scarred up. That's PLL back there, posterior longitudinal ligament. This is foramen on the left. You can see a little herniation in there. I'm zapping away. But otherwise, that's all PLL. And there's dura behind it, you know, right there. So, looks good. I don't see any subligamentous herniations. Just got to get that guy, clean this side up a little bit and we'll be done. All right? There's still a behemoth here.
The next case is one level.
A leviathan. Yeah, the next case is one level. I am sweating like a dog. Is that a thing? Huh? Don't say they don't sweat. They sweat. I've seen sweat.
Through their tongue.
I have dogs. I've seen sweat. Who says dogs don't sweat? I have 6 dogs, and I've had dogs my entire life. They sweat. That's a fallacy. Sorry, I can't agree with you on that. By the way, I was driving with my daughter to meet my mom for dinner this weekend at about 7 on Merritt Island, and we look over to the side and there's this woman holding onto a pit bull with her leash, and her son has got to be like 6 years old, and another pit bull had ran across the street and they attacked each other, and they were in a death grip, just ripping each other's bodies apart. So my daughter said, "Stop, let's go help them." So we stopped. No, I had to get the dogs by the collars, and I literally had to time their biting so I could release them from each other, but I got them released. And some guy came and helped me grab one dog, and then the woman and her kid took their dog, but ultimately we got them separated. Huh? Of course they were injured. They were shredded. What happens when... What happened to this thing? Who pulled it out? That's what happens when pit bulls... I tell people, why would you buy a pit bull? I mean, pit bulls were bred in the South for hunting hogs, pigs, wild pigs. Their whole purpose is to bite and lock their jaw on the pig's throat. Huh? Well, this guy was, the guy whose pit bull came and attacked was letting his dog just go out in the front yard to take a piss and stretch its legs at just the wrong time. Well, he didn't even admit it was his dog, but he actually took the dog across the street, and I saw he took it into his house. The police have already called me. They want me to testify, and I plan on doing it. Really? Wait, so the pit bull came and attacked your dogs while you were walking them? Uh-huh. Oh, but did he latch on, or did he just came over? Wow, that's crazy. So is the pit bull trying to bite him?
Yeah, he was not happy, but we got him, finally someone came
I just want to look at this area right here. That's all.
You guys are braver than me. I wouldn't.
Huh?
You guys are braver than me. I wouldn't get entangled with those dogs.
Well, it was either the woman was hysterical and the kid had no clue what to do. He's 6 years old, 7 years old. They needed somebody to help them, and their dogs were just tearing each other apart. I wasn't going to sit by and not do something to help. They would have killed each other. Yeah. The one's tongue was turning blue. Anyway.
So that dog's dead.
And the guy came out with a metal pipe and he started hitting the dog on the head. And I was like, don't do that. That's not going to make it better. They're not going to release with a metal pipe. No, it's terrible. It made me sad too. It's like, just what you really need to do is keep your damn dog locked up. Yeah, now you gotta have to take it to the vet and get, frickin' surgery for skull fractures.
When I was 7 pounds, you all have to wear it.
No, but seriously, if you're gonna own a pit bull, you better know how to manage that dog. All right, we're done.
Eyes on, please. Thank you.
All right, well, if you have questions, feel free to type them up. I'll answer them for you. But we've completed the Deuk laser disc repair. 2 discs in the neck, C5-C6, C6-C7. They're both herniated. This patient had her accident in 1998. So what is that, 24 years ago? And just getting worse over the years. You saw we had at least 30 herniations between the 2 discs. And that means that she's herniated 30 times. Lifting things, probably carrying things that are heavy, just pushing more pieces out every time she's reherniated. And those pieces that are pushed out are called fragments of herniation. Let me show you. Here's a bunch of them right here. Can you see, Henry?
Yeah.
Can you see these fragments right here?
There we go.
Right here?
Yep.
They're all over the place. They're small. They float out, and then they get on the stuff. But we're sending a few of the pieces to the pathologist to look at, but we've got tons of fragments everywhere. Each one of those represents another incident of herniation. So my advice to you folks, you have a herniated disc, get it fixed early before you lose all your disc material. All right, write your questions up, and I'll be happy to answer them for you. Again, I'm Dr. Ara Deuk-Majan at the Deuk Spine Institute. All right, I'm going to just show our audience real quick. Can you see this, Henry?
Yep.
So the whole surgery was done through a 4mm tube and a 4mm incision. This is the left side of the neck. The breastbone, collarbone is right here. Face is there. I'm going to take this out, and you're going to see how small the incision actually is. Now remember, our patient's completely asleep under anesthesia. All right, I'll apply pressure for just a moment in case there's any venous ooze. Again, if you have questions, type them up. Otherwise, Henry, will you put a link to our app? We have a free app you can download for your iPhone or your Android. The Deuk Spine Institute app. There's no charge for it. It's free, and it's got great information. All right, can you see over here?
Yep.
Take a look at this. That's the whole surgery done for 2 herniated discs, no fusion, no artificial disc, no metal, through a 4mm incision. Pretty cool. All right. Great job, everybody. You enjoy the surgery? Good. Luis, will you check with Chet? I'm going to say no complications. Blood loss is, I would say, 0.5 mil. This was a DLDR. Left approach. C5-C6, C6-C7. Dr. Deuk here at Deuk Spine Institute, and it's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L45, L5S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Deuk. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you said, what are you going to do now? They said, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deuk Major. I'm here with one of my patients, and you traveled to Deuk Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Deuk Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Go on.
And is that because we have you doped up on powerful painkillers?
Nope. None
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes.
but the symptoms came back.
Came back.
Yeah. All right, well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. I did arthroscopic.
That's right, arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah. I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you going to do?
I'm going to go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, 2 patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, Narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Hello, I'm Dr. Deuk Majan, and we've just completed a cervical Deuk laser disc repair on a patient with 2 herniated discs, C5-C6, C6-C7. She had a disc degeneration, bulge herniation at C5-C6. She had a disc herniation, bulge degeneration at C6-C7. And the herniation was causing neck pain and arm symptoms, like arm pain, weakness, numbness, tingling. And there was pressure on the spinal cord as well, so there was spinal cord dysfunction. So we went in through the front, we made a little cut in the skin, went down to the disc, went past the front of the disc and middle of the disc, ended up in the back of the disc. And in the back of the disc, we were able to identify, and I'll show you what I'm talking about, using a little model of the spine. We were able to identify the herniation back here in the back of the disc by passing through the jelly of the disc with an endoscope and then removing the herniation with the endoscope and the laser. So let's take a look at that. You got a bone and a bone, number 5, number 6, and the 5-6 disc. And we went through the 5-6 disc with an endoscope to the back, and basically I used the laser to zap all this away and grab it out. You all saw that through the tube. Okay, and I could sweep back and forth across the back of the disc, so I got the left side, the right side. We got the spinal cord decompressed, the nerve roots decompressed, I removed bone spurs. So we got rid of the source of her pain, and now she's gonna do fantastic. We did all that without removing the disc. If you take the disc out and scrape it out like in an ACDF or a artificial disc, then you're left with basically a gap between the bones. You need to put something in there, and that's why people end up getting fusions done, because the surgeon puts a cage in there and then a metal plate. Avoid fusion, avoid artificial discs. They're completely unnecessary now with endoscopic spine surgery. You've watched a Deuk laser disc repair, C5-C6, C6-C7. Our patient is waking up. She'll spend about 30 more minutes in recovery, and then she's going to go back to her hotel. Our patient traveled to Deuk Spine Institute from, do you remember?
I'm sorry.
I don't, oh, Ohio, I believe it was Ohio. She's from Ohio, if my memory serves me correct. I could be wrong about that. But we get patients from all over the world, and we're located in Florida with Deuk Spine Institute, but she traveled here with her family, I believe from Ohio, because she did not want a fusion surgery. Hopefully we'll be able to do a testimonial on her, and she'll tell you herself her story. But our next patient travels to us from Mississippi, and he has a herniated disc at C5-C6 on the left side. He's got weakness in his arm, he's got numbness in his arm, and he's had symptoms for about a month now. And he has a massive herniation at C5-C6, and he's getting worse. So we're going to be doing another cervical Deuk laser disc repair. This time we'll be coming from the right side of the neck, making a little cut and going and fixing the herniation, which is more to the left side. Okay, hope you join us. That'll be about 30 minutes from now. Are there any questions?
Yes, we do. Got one from Miguel from Facebook.
Yes, Miguel was asking during surgery about a thoracic disc herniation, which he has on the side, and it's causing thoracic pain and pain, I think, around his rib. And Miguel, definitely we can do the laser surgery we just did for that. If you look at the thoracic spine, you have a bone and another bone, and then the herniation off to the side. We use the same technique, except instead of coming from the front, we come from the back, and I can go in with the laser and remove the herniation and repair the annular tear, getting rid of the thoracic pain. Miguel mentioned in his comments that his surgeon said, I can do a laminectomy for you, and you'll probably end up paralyzed. So we hear that all the time from other surgeons. Folks, avoid laminectomies. Laminectomies are destructive. That's where your surgeon goes in and removes the lamina. That's a normal piece of bone. Shouldn't be removed. You need it. It's part of your spine. And also removes the facet joint, which is the joint right there that holds your spine together. So that surgeon wants to remove the lamina, remove the facet joint. Now, that surgeon won't fix Miguel's back pain because the back pain comes from a tear in the disc, and the surgeon's not going to go fix the tear. He's only going to unpinch the nerve from the back. That might help rib pain that radiates around, but it will not help your thoracic pain at all. You want to avoid laminectomy. They don't work. They just cause damage to your spine, and your surgeon is right to steer you away from the procedure because it's a horrible procedure, doesn't work, and it's unnecessary. What works is the Deuk laser disc repair for thoracic spines. Also, Miguel has been told to go see a psychiatrist because he's in so much pain and he's not feeling well. Miguel, you don't need a psychiatrist for thoracic pain. You need surgery to fix the thoracic pain. Don't let these crazy doctors that don't know what they're doing mislead you and have you do treatments that are completely unnecessary. Your pain is coming from a tear in the back of the disc. I will fix it for you if you come here. And I've done 16 thoracic disc herniation with thoracic back pain. All 16 patients had 100% of their back pain go away. Okay? So don't delay it. Come out to Deuk Spine Institute and we can do your endoscopic surgery here. Any other questions?
Yes, we have two questions. Another one from Miguel is it normal that you can't breathe well with a T8, T9?
So Miguel's saying, is it normal you can't breathe well with a T8, T9 herniation? Well, if every time you're breathing you're feeling pain and the pain is restricting the movement of your ribs and your chest cavity, yes, you're going to have trouble breathing. Pain is one of the most common causes of people having difficulty breathing. So yes, it is common.
And then the last question is from Reiko Pilot from YouTube.
Hi, Reiko Pilot. We've had a few questions from you. Glad for your participation.
And they asked, bone spurs on vertebral bodies look like they curl out and up/down. Mm-hmm. Does the laser solve the up and down portion or just the sideways jutting on the plane of the herniation?
Yeah, so thanks for asking. You're asking about bone spurs. And you've made note that bone spurs come in all different shapes, sizes, and directions. You are correct. They do. However, not all bone spurs cause symptoms. The only bone spurs that cause symptoms are the ones in the neural foramen that are directly impinging on the nerve root. And I'll be perfectly honest with you. Rarely does a bone spur ever cause symptoms. Out of every 100 surgeries I do, bone spurs are causing symptoms in less than half of 1%, so 0.5%. So that means out of every 200 patients I do surgery on and fix for herniated discs, bone spurs are there in virtually every single surgery. However, they're only causing symptoms in less than 0.5%. So one in every 200 patients actually has symptoms from the bone spurs they have. Hope that clarifies that. So too much attention on bone spurs. That's a distraction. Doctors, surgeons misunderstand bone spurs. They like to tell patients they need fusion surgery because they have bone spurs. It's something the patients can see. It's something in the MRI report. It scares patients. They don't know what to do. They're confused. So surgeons use it to manipulate you and basically get you to do an open fusion surgery. All right? Don't fall for it. I actually believed the same thing when I was a spine surgeon doing fusions, when I was ignorant 20 years ago. But what I've learned over the years is that 99% of bone spurs, even though they're in a patient with pain, they don't need to be treated. Okay? They only need to be appreciated, but not treated. Thanks for asking. Great questions. We'll be back in about 30 minutes with another surgeon.